So here we go with our next debate. As you recall, you guys, that in 2 minutes means we have 2 minutes remaining. Same with 1 minute. Yeah.
Okay. Good morning. Today we are gathered here to debate the following resolution. The U.S. Congress shall repeal the Patient Protection and Affordable Care Act of 2010. Let me start off with, what is Obamacare? Obamacare, also known as the Patient Protection and Affordable Care Act, is a national health care plan that was enacted by Congress and signed into law by President Obama on March 23, 2010. Obamacare attempts to provide affordable health care, protect customers from unfair insurance policies, and reduce the nation's deficit. Right now, I would like to take the time to point out that we agree that the current healthcare system is fatally flawed and that the United States is in need of a new one. However, Obamacare is not the proper solution and should be repealed for something more workable for these reasons. Obamacare is complex, confusing, and contradictory. Prior to the healthcare reform, 2 important healthcare systems were Medicaid and Medicare. Medicaid covers low-income children, pregnant women, mothers with young children, and people with disabilities. Medicare provides health care to people over 65 and people with disabilities. Although in theory great healthcare systems, Medicaid and Medicare have their flaws. Under these 2 healthcare systems, many Americans face healthcare healthcare debt, and millions of Americans were uninsured. And government spending towards healthcare has increased at an enormous rate. Obamacare aims to supplement these 2 programs by expanding coverage to the tens of millions of uninsured Americans who are not covered by private insurance and not eligible for Medicaid or Medicare. In addition, Obamacare adds preventative care on top of what Medicaid and Medicare covers. To clarify, preventative care offers treatments that will help one avoid illness and improve one's health. Now, going back to my 3 reasons, Obamacare is very complex. The act itself is very long and dense. The Washington Post said that Obamacare is nearly 20,000 pages long, with many more to come. End of quote. And not to mention the mass of people with conflicting ideals involved in creating the reform. The people involved were all of the major healthcare stakeholders, including the federal, state, and state governments, employers, insurers, and healthcare providers. All of these people think that they will benefit from the program, but because of their conflicting ideals, they won't. Obamacare has many potential flaws, such as the option for states to opt out of expanding Medicaid. As I have mentioned in my definition of Obamacare, it is a national health care plan. Let me stress the national aspect. The original goal of Obamacare was to supply the tens of millions of Americans who aren't covered with affordable health care. If some states choose to opt out of Obamacare, what is going to happen to the people who can't afford coverage and live in those states? According to HuffPost Politics, 14 states refuse Medicaid expansion. Sure, there are special groups of people who will benefit from the reform, but we are a nation of many people. This is why we should start over and create a new plan that helps the majority and not the few. Lastly, Obamacare is contradictory. In the reform, it says that people will be able to maintain their current health care insurance plan, and that Obamacare will increase the amount of people uninsured, will decrease the amount of people uninsured. However, because major companies under Obamacare will have to supply their employees with health care coverage or pay a tax, companies will slow down on hiring and some may resort to firing their employees to reduce the cost. The employees of these major companies will not maintain the same health care plan if they are fired, and people who under other circumstances would have been hired will be at a greater financial disadvantage. Small businesses will also suffer from this policy, which Addie will explain. Today, ladies and gentlemen, me and my proponents would like the U.S. Congress to repeal the Patient Protection and Affordable Care Act of 2010, also known as Obamacare, and replace it with a plan that is less complex and less confusing and less contradictory, like the single-payer plan. The American people deserve a complete plan that will function properly and not a gimmick to settle for. Thank you.
Okay, that was 4 minutes, 59 seconds.
Got nothing on Jake.
Yeah, Jake, that was
Good morning, fellow classmates. I'd like to just begin by saying that repealing the Patient Protection and Affordable Care Act will create more negative aspects than positive impacts. According to the 2011 U.S. Census, approximately 50 million U.S. citizens are currently uninsured. That means there's 50 million people out there who do not have access to the health care they need to live healthy lives. And that's more than the population of Washington, Oregon, and California combined. And repealing this act would mean taking away the opportunity they have to get the health care that they need. As Tiana said, the Patient Protection and Affordable Care Act, also called Obamacare, or as I'll refer to it as the PPACA, was passed into law in March of 2010, and by January of 2014, became fully enacted. I'd like to use a quote by Dr. Jordan Benjamin of the American Public Health Association. Quote, "The new law will guarantee millions of Americans access to quality, affordable care regardless of health status or sex." End of quote. The PPACA itself does not provide the health care coverage. Instead, it regulates the role of the insurance companies so that the U.S. citizens won't be at the mercy of whatever the insurance companies want to do. We'd like to address three main arguments. The first being that the PPACA is predicted to help 32 million people by the year 2019, according to the American Academy of Family Physicians and the New York Times. That's 32 million people who will have access to affordable and proper health care, and it won't stop there. If the PPACA is predicted to help 32 million people within its first few years of being fully enacted, imagine how many more people could be helped in the years following. Secondly, the PPACA is geared toward equality. Previously, insurance companies could charge different people more based on generalizations, and healthcare should not be based on generalizations. It should be geared toward the individual receiving the care. According to the U.S. Department of Health and Human Services, discrimination occurs quite frequently in private insurance contracts. For example, insurance companies could charge women more than men simply because they might need more preventative care than men, or they might get pregnant. And repealing the PPACA would mean that citizens would be charged more because of their age, because of their health, or because of their sex. Thirdly, the PPACA has been the biggest, if not the first step toward healthcare reform since Medicaid. Medicaid was signed into law in 1965, according to the Centers for Medicare and Medicaid Services. That was 48 years ago. It's taken 48 years for our government to come up with a plausible healthcare reform that reflects what our country needs. And if the PPACA is repealed, there's no guarantee that another policy, even remotely like this one, will be voted in. Those 50 million uninsured people can't go another 48 years without health care coverage. Now, it is important to keep in mind that the PPACA is by no means a magic pill, as Secretary of Health and Human Services, Kathleen Spellies, points out. However, the government has an obligation to provide access to affordable and proper health care, and the government is stepping forward to make good on that obligation. Additionally, Obamacare will be able to provide affordable health care for us, the rising adult generation, and it also lays down the framework for coverage for the children and the children to come. And that's important because eventually this country will be resting on their shoulders, and we don't want to take away the opportunity they might have to access affordable and proper health care. To remind you of our standing on the resolution, we are arguing that the U.S. Congress should not repeal the PPACA because it is the biggest push forward in healthcare reform in 48 years. It is geared toward equality and is predicted to provide approximately 32 million people, and possibly even more, access to the healthcare they need to live healthy lives. And keeping those 32 million people in mind, Please vote against this resolution and against repealing the Patient Protection and Affordable Care Act. Thank you.
4 minutes, 32 seconds.
Hello, everyone. I'm here to talk to you about why Obamacare should be repealed. Tori mentioned many great points about Obamacare in her intro that are indisputable if Obamacare is executed correctly. However, because Obamacare is complex, confusing, and contradictory, this is nearly impossible to achieve. There are several examples of how Obamacare is already starting to degenerate. Although many insurance companies assume that they will get benefits from Obamacare, this is likely not the case, because people are given the option to either pay to have insurance or pay a fee to not have insurance. This is a problem because healthy young people will think that they don't need insurance, so they will choose the cheaper route of paying the fee instead of getting health insurance. Unfortunately, insurance companies only work if they have a large pool of money and only very few people get sick. This system will not work if the only people who are buying insurance are the people who will most likely need it. This will result in either bankrupt insurance companies or the cost of insurance skyrocketing for the people who do choose to buy it. Another one of Obamacare's main goals is to help small businesses provide health care. They say that they will do this by giving small businesses tax credit if they provide health care for their employees. The Speaker of the House, John Boehner, raises an interesting point. This tax credit will actually produce the opposite effect on small businesses because it is discouraging companies from expanding and providing more jobs. Only businesses with 10 employees or less will receive the full tax credit. As the amount of employees goes up, the amount of tax credit the employer gets goes down. This means that if the employer still wants to provide health insurance for their employees, they will not be able to take on any new ones. In the Supreme Court case, National Federation of Independent Businesses versus Sebelius on June 28, 2012, Obamacare was taken to court to question its constitutionality. The majority was voted constitutional, except the section that says that states must expand their Medicaid program. This was ruled unconstitutional, so the people living in the states that choose not to expand their Medicaid program will suffer. The first reason is that it will deny health coverage to about 3.6 million people living in these states. The second reason is that these states will forgo $8.4 billion of federal funding that the government is willing to give them to provide health care for their people. Finally, the third reason is because the state government will have to pay more medical bills for the uninsured people in critical care. Because of these many issues with Obamacare, we suggest that the healthcare system starts again with a new clean slate. Just last month, on May 23rd, there was an article in the Wall Street Journal written by Mark Ling talking about Obamacare. Please take this lightly because we think Mark Ling was joking by saying, and I quote, "The Obamacare authors and strategists are wrong, but they are not dumb. They know that this 20,000-page monstrosity could not possibly work, and they are smiling because their strategy is working." He says, "Obamacare is designed to fail disastrously so that the same architects can ride to the rescue with what they have always wanted, a single-payer, nationalized healthcare system. This is the alternative that we propose." Mr. Ling is saying that Obamacare is destined to fail, and because of this, we need to set up a new nationalized healthcare system that will fill its place. This single-payer system means that healthcare is an entirely government-controlled organization. This would eliminate all insurance companies. This means that the cost for insurance would go down drastically, because it would eliminate all competition from these insurance companies. Also, because government would not be trying to make a profit off of healthcare like insurance companies are now. Because everyone is paying the same small amount for health insurance, this would mean that everyone gets equal coverage based on the health insurance and not on their wealth. And as Tori mentioned, it will also not be facing any discrimination problems because everyone is getting equal health coverage. To conclude, because Obamacare is complex, confusing, and contradictory, we think that the single-payer healthcare plan would act as a stronger and safer alternative. Thank you.
4 minutes, 42 seconds.
All right, sorry, my voice is a little sorted in. So my opponents have pointed out that the Obamacare bill is complex, long, and dense, and will be hard to enact. Now, the problem with repealing it, though, is that the Obamacare bill will do many good things to the American public. And as Tori has pointed out, it took us 45 years to enact anything at all. And there's huge numbers of difficulties getting this enacted in any case at all. Bill Clinton, with both houses of Congress, back in, I think, 1991 or something, got it. 1991 was unsuccessful in being able to pass it. So saying that we will be able to pass an individual a single payer option effectively in the next few years is just not a viable option. The perfect should not be the enemy of the good. In this case, taking one step backward will not lead to taking 2 steps forward. And this is very important to remember. And we also have examples from our own history of social service programs being advanced by starting off with a humble beginning and then expanding from there. A very important example of this are the New Deal programs, such as Social Security, which had humble beginnings to start off with, but later was able to expand into what today is a very good program and one of the central parts of our social services provided by our government. So, like I said, perfect should not be the enemy of the good. Taking one step backward will not lead to taking 2 steps forward. This bill is a place to expand from, not a place. Yeah. All right. They also worry that the states have the option of expanding Medicare. Now the issue, aren't given the option. Now this was brought up by the United States Supreme Court, so it was part of the bill that they would have to provide Medicare. So the issue is reforming this. You can't just force the states to because it's unconstitutional. So what the Fed has done instead is they have offered funding and made it very, very attractive for the states to take that on. And the states that have not chosen to do this have proposed systems that are fairly ineffective, which will hopefully disappear and be replaced by the federal funding. Like Tennessee has a lottery system. Doesn't make a lot of sense. So the goal is that, so hopefully they will accept the federal funding. An example of this is states that have proposed good health insurance, like California, actually may attract businesses. This is kind of a very random anecdote. I just recently learned my mom's colleague is going down to California because they're offering new healthcare systems that are lower cost, and he can actually start a business there instead of working at UW. So states like California with these attractive healthcare plans will attract businesses, and hopefully that interstate competition will lead to everyone taking sensible choices that help their state the most and help their people the most. They also bring up a very important point, that this may damage jobs currently. Now, one of the major difficulties with our healthcare system today is that the insurance companies are not regulated and continue to raise the cost of their insurance. Now, this isn't regulated by any body, and they can basically do whatever they want. Now, what this means is that employers that are trying to offer their workers insurance will continue to offer them insurance, but they'll take away from their pay. So that's a main reason that we see a lack in, this is a New York Times article published today, by the way. We'll offer it's an editorial. You'll see a lack of rise. So that's part of the reason it's a lack of a rise in wages over the current years. And having the regulation of this will reverse this process. And not to mention that, it will reduce the cost of our healthcare in general by preventive measures that Tiana mentioned and that Tori mentioned. And lowering the cost in general to the American public will help our economy strengthen. It will help us be healthier, and it'll help the people who are less fortunate and do not have access to as much healthcare be healthier. And thank you. That's what I have to say.
Don't clap. No. clapping. I know you're tempted, but no clapping.
Also, I'm sick, so that's
4:52. 4:52.
Jack needs Obamacare.
Okay, we have time for our questions now. We'll start with, let's do the three on this side of the room, and hopefully we'll get to the two of you. We'll begin with Kiara, Griffin, and then Noah.
So I have a question for Jack about the single payer plan, the option that Addie proposed. So it kind of fits into multiple facets, and it's a lot of things that we can address. So what does it like to know what issues there would be with that plan in particular, and why we couldn't have Obamacare in the meantime while that plan is developed?
Yeah, that's actually part of my argument. So the resolve here is to get rid of the resolution, sorry, I said resolve on the board. The resolution today is to entirely repeal Obamacare. Now, they are claiming that they could replace it with a single payer option. Now, there's no reason, like you said, that we couldn't add that on top of this, but it's been so hard for the Congress to pass anything that this is sort of a good intermediary step. And if we repealed Obamacare or Patient Protection Affordable Care Act, what would happen is we wouldn't be able to enact anything else because of the political climate in the United States. And so we wouldn't get that single payer option which may be one of the better options. And so, like I said, the perfect should not be the enemy of the good. And
Thank
we
you.
would just take a second.
Would you like to respond?
So we agree that we need a new plan because it's not worth it to settle for a plan that isn't working right now. We should be starting with a completely clean slate and taking out Obamacare because clearly, because of all the things I mentioned, it's not working. So we need to start with a new plan. From a quote in the National Healthcare Program, the National Healthcare Program, all Americans would receive comprehensive benefits under the single payer system. Coverage would include medically necessary services and including habilitative long-term and home care, mental health care, prescription drugs and medical supplies, and preventative and public health measures. So this would provide more opportunities for people than Obamacare would originally. And Obamacare just isn't working altogether, so it's important for us to start over with a single-payer healthcare system.
Thank you. I believe, well said, yeah, it's Griffin, thank you.
So this is for Addie. You mentioned fees as being like an alternative to paying for healthcare. I wasn't really clear on that.
For sure. So in that same court case, in this court case, okay, in the Supreme Court case, the same one, the National Federation of Independent Businesses versus Affiliates in June 2012, there were many other sections that were questioned as being constitutional. One of the things that was questioned was the fact that it's requiring people to pay, to sign a contract with another private company, which is like the insurance company, with a fee, or as the alternative if you don't do with that, if you don't sign with them. So that was actually ruled constitutional because that fee is now called a tax instead of a fee. I'm sorry, I said fee. So you can either choose to pay this tax to the government to not have insurance, or pay to have this health insurance. Does that kind of make sense? Okay.
Response from this side.
Yeah, so in response to that, Patient Protection Affordable Care Act will, by 2019, cover 95% of Americans and give them new health care. So the issue is, somehow we have to pay for this. And if we mandated insurance companies to accept people that had pre-existing conditions, they could simply, when they got sick, buy insurance and be covered. Now, this is why we have the individual mandate. It keeps the cost of insurance from skyrocketing because people do this in practice. And so sort of this individual mandate is basically the way to pay for Obamacare. And it's a fairly reasonable approach that isn't too costly on folks.
Thank you. I think actually we had a hand back here, we've got so many questions, but Noah had raised his hand first.
Addie, so the Patient Protection and Affordable Care Act, which was proposed by Republicans initially, has been considered a compromise by many right-wingers. How do you propose to get a more socialized system passed in the short medium between the time when the act is repealed and the necessary time when an act will be needed for the country to sustain its health care?
Yes, I do see that that would be very difficult because it did take a very long time to pass, as this side has mentioned. But we don't think that we should be kind of just agreeing to something that only partially works. And instead, we should be working really hard to create a system that will work for everyone, even though we know that it would be difficult to pass in Congress.
All right, my response is, Noah kind of made one of my points. It's going to be very, very difficult for anything else to get passed through. It's also kind of hard to claim that Obamacare is going to be this ineffective since it's yet to be enacted. It gets enacted. Many parts of the legislation have been enacted, but the majority will be acted January 1st, 2014. And like I said, it's going to be very, very difficult to pass anything through. And the hope is that if there are deficiencies in the Patient Protection and Affordable Care Act, they can be amended, and repealing it entirely would just kind of undo all the good work that people have done.
I think this will have to be our last question. Glenn?
This question's for Tiara. You and Addie both mentioned the fact that it was ruled unconstitutional for them to demand states to provide coverage, and so that Obamacare wouldn't work because some states could choose not to expand their health care. But it sort of seemed from what the opponents, the opposition said, that it was in the bill that all states should include this, and that the courts read over the bill and then said that it's unconstitutional to ask states to do this. Would this not be the case with any health care plan, that you couldn't demand states to do it because that's unconstitutional, including the single payer system? And so isn't this actually a more of an effective plan to try to entice states to do this with the federal funding? It's how do you respond to that?
Yeah, we did need a quick answer here.
Okay. Well, I would just like to say that, first of all, we would just like to clarify that Obamacare was, just the way Obamacare was created, it was created by many people with controversial ideas. And I think the reason why it was so easy to get passed was because it was trying to please everyone. And so we would also clarify that we had said that 14 states have already decided to not sign with Obamacare. And what we're proposing, if I think this is semi-answering your question, is that even though the single payer plan would be hard to get states to compromise on, Obamacare is also hard to get states to compromise on as well.
Yeah, I guess I have a response to that. So, yeah, there are a certain number of states that are refusing to have this coverage. Now, I think most of those states tend to be more Republican-oriented states, so they wouldn't be taking it for political reasons. And as other states have great success with this expanded Medicare, they will probably reform themselves too. At least would be the goal.
Thank you. We need to move quickly to our closings. Charlie.
Hello. In the rebuttal, we discussed a variety of reasons why we think that you should vote to repeal Obamacare. We'd like to recognize that the opponents have made some good points that it's affordable and accessible, and we agree with that. And we're actually we want a system that would do that. What we're not so happy with is the fact that, as it currently stands, it is A, very complex, B, confusing, and C, quite contradictory. An issue brought up by Addie that Jack referred to in the questions was that the the people have to pay for it, or either the government. I didn't say. What I mean by this is, if you're young and strong, you can choose not to go into the plan. But the problem with this is it's supposed to be a set plan in the single payer plan, but as it currently is, it's not. This is a clear example of why it's contradictory, because it promotes demographics to opt out of it. Another issue Chowder brought up was it's inherently complex and confusing. The document is near 20,000 pages long. Now, 20,000 pages is kind of hard to grasp in your head, so think of it like this. It's the entire Harry Potter series, 5.8 times. It's the length of the Bible, 58.6 times. And it's the length of Catcher in the Rye, 72 times. Do you really want to build that that's so inherently confusing and long? It's true. Lastly, I'd like to revisit the idea of an alternative method. The single payer plan. What it lays out is a foundation for a plan that leans more on the true national health care plan. It's truly government run and will provide equal, cheap, and arguably non-corrupt and non-discriminatory. A quote Obama said on July 22nd, 2009 was, "I want to cover everybody." Now, the truth is, unless you have what's called a single payer system in which everybody is automatically covered, you're probably not going to reach every single individual. Therefore, we should strongly recommend that you consider repealing Obamacare and vote for a new, less confusing, more concise, and less contradictory system. Thank you.
Thank you. That was 2 minutes, 23 seconds.
Countless Americans do not have health insurance right now. Leslie Elder was one of them. In 2005, she was diagnosed with Hodgkin's lymphoma and did not have insurance that would provide her with the proper treatment for it. In addition, she tried to receive Medicaid for decades. Hodgkin's lymphoma has a high survival rate, but without insurance, Leslie did not receive proper care to fight her disease. At the age of 63, she passed away prematurely. The solution seems simple, right? We need affordable health insurance and education with regards to health insurance options for all Americans. Currently, 15 million Americans like Leslie are uninsured, according to an article by Margot Sanger-Katz in the National Journal. Yet, with the implementation of Obamacare, 30 million more people are expected to gain coverage, according to Jeff Spraven of the Wall Street Journal. Like Tory previously stated, the PPACA aims at giving the universal right of health care to the 50 million who are uninsured by giving health care coverage that is geared towards equality. In addition, the PPACA will also help regulate the objectionable practices common among insurance companies, and it is a much-needed reform since the implementation of obsolete Medicaid. While Obamacare might not be the magic pill that will solve the American health care issue, it is the only solution currently. As the younger generation, we have a choice of making our country healthy and equal, or limiting the right of health to only a small minority. According to Article 25 of the Universal Declaration of Human Rights conceived by the United Nations, everyone has the right to a standard of living adequate for the health and well-being of himself and of his family, including medical care and necessary social services. Obamacare secures this right and enforces equality in health care for any United States citizen, no matter their income level. It fortifies the overarching American principle of equality for all. With the implementation of these various healthcare reforms, millions of Americans will receive a basic human right, equal and proper health care. Thank you.
That was also 2 minutes, 23 seconds.
Whoa.
2:23. Yeah. Both of the closings. Okay, I'm going to ask you to step outside while we quickly take a vote. Those of you who feel that the opponents did a more convincing job arguing their side, will you please raise your hand, keep them up there high. This is proponents.
This side. Keep them high, follow.
Now keep them high again, just because I saw some hands moving around here. One, two over there. Yeah. Okay, and the other side. Sam, you can't raise your hand. Don't you scratch one day?
Sam really wants that thing.
V8? Okay. Okay, now, three people who will give some comments to the proponents, Monica, Katie, and Lucy. People who voted for the opponents. Maybe someone we haven't heard from, Max, Katie, and Sam, if there's time, Lacey, jump in there. Okay, you guys remember who I just called because I always forget who I called. Give them a hand. Come on in.